I appreciate the opportunity to be here. I have a lot of soapboxes, I suppose, as a child and adolescent psychiatrist, a lot of thoughts that I have about kids, about girls, about boys, about how to raise kids. And so this gives me an opportunity to talk about some of those things. I hope that in talking about those things, I still meet your needs and answer some of the questions that you had in coming. So these are some of the organizations that I'm affiliated with. What I want to do today, make sure I'm in a good spot, is to talk about the 3 questions that I get asked most frequently. And they are some variation of this. What causes mental and emotional problems? It seems like it's everywhere. I don't understand it. I have a friend. The rates are rising. Where do these problems come from? Is what I'm seeing a problem? So this comes in the form of, let me tell you about so-and-so, and you let me know if they need help. And what can I do about it? And so I wanted to start by at least addressing those questions and then hopefully smoothly segue into resilience. So this is a thought experiment. This is my runner. This is someone who decided to run a half marathon. And halfway through the marathon decided she was just too tired. She wanted to give up. Fatigue had settled in. If this person came to you, let's say she'd tried a few marathons, she came to you as a friend and said, I just can't get past mile 10. I run out of gas. There's no way I can run more than 10 miles. In that moment when she's too tired to go on, what is your explanation of what's going on? What comes to mind in terms of you saying, this is what I think your problem is? Now, some people will say that this is, let's call this a biological problem. You need to focus on better sleep, nutrition, maybe better stretching, maybe lose some weight. Maybe you're genetically just not able to run a marathon. Some people will have some kind of thought about a psychological approach. We need to focus on the ways to improve your motivation or your self-reflection. Some people might have a spiritual explanation even, that you could focus on prayer, faith, spiritual preparation to run. I hear some people make it a social issue, maybe if you ran with friends. It's an educational problem. If we focus on education about running and the physiology and how to prepare and how to train, what you need is just a little more instruction. Or you might say this is an environmental problem. It's the weather conditions or the type of race that you're running in or the shoes that you're wearing. Okay, so any problem can be interpreted in a range of ways. Now, this question, which of those is right? You don't know. Maybe all of them, maybe one of them. It gets complicated when it comes to something even as simple as fatigue. So what if we take a different case? This is a mom with depression who's just had a baby. Okay? What's your explanation and your approach for how to help somebody in that situation? Are you going to talk about sleep deprivation, hormonal changes, genetic predispositions for depression? Are you going to help by giving encouragement and motivation? You make it a psychological problem. Talk about self-doubt, feelings of incompetence, how to think differently about the situation that she's in. This is a divine trial, a lack of faith, have an eternal perspective, a challenge from the devil. Social isolation, lack of support, changes in family dynamics or other social pressures. Maybe she needs education about how to care for a newborn or how to care for her own self-care, about mental health problems, postpartum depression. Maybe this is an educational problem. Or maybe, again, it's an environmental problem. When you have a baby, there could be financial hardship. There's changes in family dynamics. Maybe it's a colicky, difficult baby. So what is the cause of postpartum depression? I lost my little dot. It could be all of those. But the point I want to make is that if you come in with your own pre-existing idea of what's going on for this person, you're just guessing. And it changes the way that you intervene and try to make a difference, and you might be wrong. These days in modern neuroscience, I often get a question about, do you think this is a biological or a psychological problem when we're talking about mental illness? And neuroscientists like to say that that question itself is bio-illogical, because we know so much about the brain and about neuroscience these days. For example, I'm going to come stand here for a minute. Did you know that your environment affects the way that your genes are expressed? You have a genetic code, but not all of those genes will be expressed under all the same conditions. And so you can have variable gene expression based on your environment. Your environment can certainly affect your psychological health, obviously. If you've had a loss or a trauma. We talk about going to holy places, if you will, pilgrimages, temples to encourage your spirituality. Psychologically, we have this, I wrote this word ACEs. ACEs means adverse childhood experiences. There was really fascinating research within the last couple of years about how children who had adverse childhood experiences grew up and had a higher incidence of different medical problems. They had higher rates of obesity, of diabetes, of heart disease, of substance use problems. So we know that even adverse childhood experiences can predispose you to having medical or biological problems later. We could talk about the psychological impacts of emotion and learning. We could talk about how your early attachment, social relationships affect your psychological development. You could talk about your ability to learn, being your cognitive skills and your IQ. They have this thing now, we talk about mirror neurons, which is this neuronal system that seems to be activated to differing degrees depending on the person in response to what you're seeing in somebody else. So you can hook people up to these sophisticated MRI machines, and some people will show brain waves that mirror what they're seeing in other people around them. And so there's this big body of research about how some people are biologically more capable of social interactions and empathy. Spirituality and social, obviously, it's about love, gathering, unity, service, spiritual teaching. We could go on. The point is that when it comes to what causes mental illness, it's complicated. And we all want to put something in a category, but what I'm going to encourage you to do is, now that may be overstating it to put a toxic symbol on top, but I want to encourage you to think about not going there. It's not very helpful. How helpful is this question when somebody gets a cold, asthma, autism, a heart attack, or cancer? If somebody tells you they have asthma, do you say, oh, how did you get that? You don't. You say, can I help? Am I treating it? If somebody says, I have a cold, do you say, no, where did that come from? Were you here? Were you around that person? Were you too cold? Were you out in the rain? Or do you hand them a tissue and bring them soup? Right? So to some extent, mental illness, we don't treat it as fairly as we do other things. Part of the problem is, too, there's this aspect of blame. We want to know what caused this because we want to know what to blame. And often that's not very helpful. Sometimes we have these, in mental health, we have these, how would I describe them? Decreasing the stigma campaigns. And they are well-intentioned. And I think they do a lot of good. But sometimes what you see in those, I would encourage you to be cautious. You see this swing back to everything being biological, that there's nothing people can do about it, that it's a genetic problem. It's just like heart disease or cancer. And not only is that's not an entirely fair conceptualization of how complex mental illness is, it turns out it's actually not helpful. They've done research to show that whether or not a clinician has a biological explanation for illness versus a psychological explanation for illness affects the amount of empathy that they give. And surprising in the research, if you think that that problem is entirely biological, you're less likely to be empathic. So being helpful is a lot more about identifying needs than identifying causes. Are you still with me? You have to be so careful about causes. So put away your investigative hat that we all put on about trying to figure out what's going on so we can fix it. You can still use that little hat, but it's going to be about identifying a person's need and responding to it. Think about depression as an example. Has anyone, just a quick show of hands, have you known people that have had clinical depression. They get this change in their personality and the way that they think. They're not themselves. They start saying things that strike you as hopeless, sad, odd. In my experience, the two thoughts that depressed people have most frequently are, I'm broken, and I'm a burden on other people around me. And if you jump in too quickly with your logical deduction that this is the problem and I'm going to fix it, what have you just inadvertently reinforced? That they need to be fixed and that you have to be the one to do it. And so you have to be so careful. So let's talk about these things. You're probably wondering what this has to do with resilience. This is a really big buildup. Stay with me. This is what I do, and this is not to just indulge myself, but I think it's helpful. If somebody comes into my office for a professional evaluation, I think of layers. This is like an onion. Shrek talks about how, ogres are like onions because we have layers. So I think in layers. The first layer is a developmental and medical history. I want to know things like genetics, biological contributors, do they have different kinds of illness, prenatal exposures, drug use, general health, sleep, appetite, daytime energy, the whole biological system. Once I have a feel for that, I move on to anxieties, early life experiences. Was there something that happened that got us here? Was there been something traumatic? Is there a sort of existential anxiety about death or meaninglessness or social isolation? What are the quality of your relationships? Are there long-term patterns, recent changes, both objective and subjective? What does it look like your relationships seem like from my perspective, and how do you experience them? And what's your interpersonal style? And then interests, I've double-clicked. Interests, hobbies, strengths. I call these metaphors for achievement, growth, resilience, creativity, sense of competency, mastery. So this is my 2-hour assessment that I want to know all of these things. And there's reasons why this is important. For simplicity, let's take those same categories that can be a little complicated and just call the medical one physiologic. Physiologic problems or physiologic needs. Let's call the next one basic safety, your basic sense of safety in the world. Connection is your quality of your relationships, your long-term patterns, recent changes. And then competence are the interests, hobbies, strengths. Now, who's had Psychology 101? And does that look familiar to anyone? Because in most early psychology classes, they show you this little triangle that's called Maslow's hierarchy of needs. Is that familiar? I love that people know this. This is a brilliant and underappreciated little bit of psychology. And it basically summarizes, to this day, after years of education and experience, how I still approach and think about people. Maslow went on a little further. He had the top of that pyramid is called self-actualization. It's this process of becoming. It's this idea he believed, in contrast to the behavioralists who had been sort of gotten a lot of press at the day, where they said people are born as blank slates and it's our job to sort of turn them into whatever it is that they're going to become. And unfortunately, a lot of parents still kind of believe that I've got to give my kid, train my kid, mold him into whatever he's going to become. Maslow deliberately said people are born with their own kind of innate abilities, talents, drive, and what he called sort of what you're meant to be. And our job is not to give your children every single thing that they need, but to provide a foundation of safety, connection, and competence so that they will then self-actualize. And it's this idea of just becoming and being and growing in that, and growing into that. Okay, a little bit more. It gets slightly, so this is Maslow. And then I spend a lot of time thinking about this guy too, whose name is Erik Erikson. And he came along and said, yes, we all sort of have basic needs, safety, connection, competence, but depending on how old you are, it might be a little different. Here's a 2, an 8, and a 16, and a 5-year-old, it looks like. And if you're a 2-year-old, what are your connection and competence needs? Mom, mostly, and what he called autonomy. If you're a 5-year-old, you're thinking more about both parents, and they have this goal kind of initiative. Their job is to kind of be able to start things, to start projects, to carry. These are the kids that drive you crazy because they've got this idea in their mind, this plan. And when you interrupt the plan, they can't handle it. They go nuts. It's sort of their developmental stage to start things, these little projects. 8-year-olds, what are they thinking about? Parents and teachers. And their goal is industry. It's about competence. They need all of those recognitions that we give to 5 and 12-year-olds about, you're so great, and you're doing so good, and we're building them up. They really need to feel that competence. And then teenagers, what are they thinking about? This is obvious. Their peers and their identity. They have kind of different connection and competency goals. I always think it's interesting, by the way, this is an aside, but I find parents spend a lot of time worrying about their 5 to 12-year-olds and their friendships. Are they making friends? Do they have friends? How are they doing? And yet, what are their most important relationships in that age? Their parents and their teachers. And then we get to be teenagers, and we all worry, I'm losing my relationship with my teenager. What's happening with our relationship? And yet, what's their most important relationship? Their peers. And sometimes we have it backwards. And so we just have to acknowledge that there's different needs, different stages. And this goes even through adulthood, actually. There's this beautiful, I'm very tangential right now, there's this beautiful crescendo, decrescendo that happens through a development. Because if you think about it, the 30 and 40-year-olds, like the adolescent, are still kind of struggling with relationships and their identity. The sort of 40, 50-year-olds are struggling with this idea of what they call kind of like the latency or the toddler age, this sort of how do I keep up and exert my influence and power in a world that's changing faster than I can keep up with? And then when you get to sort of the oldest adults, they're struggling with sort of their most intimate relationships and this sort of unruly body that they're trying to manage. And so there's this really beautiful, like I say, crescendo, decrescendo. So what does this have to do with resilience? This is where we get to the point. And I'm going to summarize for you guys, if I can, this is ambitious, all of the research on resilience over the last 40 years, just on this slide. So the first major topic in resilience was this idea of locus of control. So people that were resilient seemed to believe more than others that they had control over their own experience and their own life, that they could change what was happening, that they were not what they had internal and external locus of control. The internal locus of control people felt like, I can make a difference. External locus of control people are like, I think of them as like boats on a water. And it's like, you say, how's your mood? Good now, but I don't know tomorrow. It just depends on what the weather is and how the waves are. It's this idea that life is just kind of blowing me around. And it turned out having an internal locus of control was a good marker of resilience. The next area of research I will summarize as this ACEs research. And you'll often see this what do they call those? Like the scale. And they weigh adverse childhood experiences versus strengths. And it's this idea of what are your resources versus what are your difficulties. And if we could just sort of limit and decrease the number of difficulties and sort of build up people's resources, those kids tended to do better. And even young people who had an ability to be resilient, it turns out everyone has their breaking point. And so you could traumatize even those kids enough where they could kind of lose it. And so there was a big focus on how do we decrease these childhood experiences. Positive, supportive relationships with an adult. The Harvard people who study resilience say that a positive relationship with an adult, it can be a teacher, ideally a parent, maybe a coach, is the scaffolding and the most important influencer of resilience. Then they study these kids from inner cities and difficult backgrounds that have been traumatized, kids from war zones, having a meaningful, stable, consistent adult relationship was very important. Some people have studied faith and cultural traditions that can contribute to connectedness and also a sense of hope and perspective. And then you hear this word a lot, perception, that it's your perception of what's happening to you that's important, not actually what's happening. And trauma people know this very well. Some people will have what might sound to us as an unbelievable traumatic experience, and they do fine. Other people can have a relatively, again, from an outside perspective, benign experience and become traumatized. And so there wasn't a way to just look at how difficult the situation was. There was this idea that how they perceived and conceptualized what was happening to them was important. And more recently, there's a very famous book that I would recommend everyone reading by Carol Dweck, where she writes about a growth mindset. And it's this idea that people who believe that their experiences are about growth and not like the wonderful video that we saw earlier with the founder of Spanx, which I don't even know what that is. Was I the only one in the room? But she had this sort of growth. Did you know that, Dr. Croft? No? This growth mindset. And so it's this idea that some people feel like, and we do this, I'm going to get on a little soapbox for just a minute, because we do this to our ninth graders. What do we tell ninth graders when they start ninth grade? You have to be careful because now things count. It's like nails on the chalkboard when I hear that. It's as if it sends this message that up until now you've had an opportunity to learn, but now it's time to be tested and to be evaluated. Now you've sort of built up everything that you will be, and now we're watching. And it really takes away from that idea that you have a lifelong experience with learning and with growth. And it doesn't just start in ninth grade. It doesn't start when you go to college or become independent. It never stops. This idea of a growth mindset is something we have to train, and we have to talk a little differently with our youth when we talk about achievement. It's not about meeting these plateaus. It has to be about growth. And again, I'd recommend that book to you. It's very great, Growth Mindset. So watch this magic trick. This is the summary of resiliency research. See what I did there? We're going to come back to Maslow. So safety in adverse childhood experiences and these cultural traditions that breed hope. Positive supportive relationships with an adult. Competence is about this locus of control that you have the ability to change things for yourself. And perception is a growth mindset. It's about self-actualizing or realizing that life is about becoming something. So this formula is pretty remarkable if you think about it. A person's needs equals resilience factors equals wellness equals, and this is what it gets even more exciting, because what do we all want to do to our young people? We want to motivate them. And Maslow called this theory originally a human theory of motivation. Because not only is it what you need, but he said, because we're all sort of programmed to self-actualize, this is also what motivates us. If you don't have physiological needs, you are motivated to get food. If your physiological needs are met, you're motivated to be safe and to provide safety in your life. But if you don't even have food, this is kind of in the context of homelessness, safety doesn't matter as much to you, right? If you don't have positive relationships as a teenager, your school competency doesn't matter as much to you. We're going to come back to that, but this is a really easy way that most of you told me you already knew before we started, Maslow's hierarchy of needs, of addressing problems. So what I want to try to do now is spend some time and talk about why this is relevant. Okay, and I have a number of case examples. I hope that this increasingly comes across as helpful to you. So let's start with May. May is a fourth grader who's been showing low frustration tolerance and even some aggression repeatedly over the past several weeks, including throwing a volleyball at a peer's face and a pen across the classroom at her teacher. I don't have to make these up. I get this. This is a very common story. So, is this a problem? And if so, what can you do? First, think about your reflex reaction. Before you came into this talk, if somebody had said this was your daughter or granddaughter or friend, you won't believe what she did, how do you initially, what happens in your brain to respond to that? She should be grounded, punished. She should, this is my favorite, she should stay in from recess and write letters of apology to everyone that she offended, right? So you immediately start thinking about how to fix this problem if you're like any of us. What I want to encourage you to do is to start at the bottom and just ask yourself, could she be hungry or tired? Is there sensory sensitivities like many of our kids have? Is there a safety concern? Does she feel threatened or unsafe at school? Are adults safe? Young kids have to feel like grown-ups are safe. Is there a secure living situation? Has the family moved? Are there difficult things going on at home? Does this person feel safe talking to the teacher? It's not just about real physical safety, it's how do you feel? Does this fourth grader feel like her relationships are strained? Are there communication problems? Does she feel seen, valued, loved? People want to feel seen. I know that sounds really strange. More than anything else, they want to be seen. Kids don't need you as much to say, you're so great, I love you, you're so wonderful, as they need you to say, I see that. I see your struggle. I see how wonderful you are. I can see it looks like you're feeling this way. They want to be seen. And it might be helpful to mention, when I say connection, does connection with children come from a day at the zoo or Disneyland? You might feel disconnected by the end of one of those days. Does it come from just spending time with kids? I'm submitting to you that you can connect in 3 minutes in ways that you may not in 3 days if you're not trying to connect. Connection is a moment, they talk about the babies and infants and moms, this shared experience, this delighted look where you know that you are seeing one another, you're on sort of the same page, and you're having a shared emotional experience. And we try to tell parents of young kids, whether they have autism, developmental delays, ADHD, any early sort of developmental issue, or you just have a typical kid, insist on connecting. Take time to connect, to feel it, okay? You know it when you see it. It's hard to describe. Competence. Is she frustrated with learning? Task completion, flexibility, problem solving, emotional regulation. These are competencies. Kids have to learn these, and fourth graders often haven't. Do I convey confidence? It's not what I was about teaching them all these things. Sometimes the only thing a kid needs, especially teenagers, failure to launch teenagers, sometimes they don't need a therapist. They need their parents to say, you're going to be fine. You're fine. No hurry. We know you, and we know that you will figure it out. Sometimes they don't need skills. They just need conveyed confidence. So what's interesting to me, now we've made it sort of up our hierarchy, what's not here? Notice what's not here. Causes. You didn't jump in and attribute blame. You didn't say this kid is unmotivated. You didn't say, oh, they probably did it because, they just are acting out or they didn't want to do the homework. We didn't jump in and do any of that because we don't know the cause. And so often people try to put together a strategy to help that just isn't helpful. Notice what's not here. Okay, let's go to Jane. Now I'm going to do a couple more and then you're going to be tested. So I hope you're learning. Jane is a 12-year-old who used to have a close relationship to her parents, but over the last 3 months seems more distant. She doesn't seem to open up, isolates in her room, bristles when parents use previously acceptable pet names like sweetheart or honey, and acts as though every family event is an inconvenience. Question, is this a problem? What do you think? Maybe? Maybe not? She sounds kind of like a 12 and 13-year-old, doesn't she? But you don't know if it's a problem, so you're not going to make any assumptions. You're going to say, well, does she basically sleeping, or is she sick? Maybe she is. Has there been traumatic events? Is she being bullied? Does she seem to worry a lot? Is she avoiding things that she used to do? Am I a safe person to talk to? A lot of parents, when I ask these questions, they say, yeah, I think she's okay. Does she basically have friends? Yeah. We don't know, but let's assume she does. Competence. Does she feel good at things? Does she do well in school? Does she show sort of increasing independence? If she does all of these things, even though her behavior is sometimes what we call mild but aggravating, she's probably fine. And it could be kind of a developmental stage, and sometimes just a little bit of time and support, we iron out the wrinkles. So if you can go through this checklist and say, I think she's doing okay, you probably don't need a therapist or you need to overreact. Now, on the other hand, if you go through these and you say, she is starting to avoid a lot of things she used to do, then you know. Then you think, well, we got to kind of work on that. I need to probe a little bit more and try to understand whether she's feeling anxious or what's going on with her. How will you know whether she feels safe, connected, and competent? So you've decided you want to probe a little bit more, and you want to understand what's going on for her. What's the best way to communicate with a 12-year-old? Right? Teenagers, this is actually a book, an interesting one, but I love the picture and the image. You listen. You will get more out of a conversation with a teenager by saying, uh-huh, wow, interesting, that sounds hard. And yet we can't help ourselves. We want to teach them everything and lecture and talk. And often they'll just shut down. Often by 12 or 13, teenagers have heard pretty much what their parents' opinion is on everything, and you're just saying it over again. And so it could take time to listen. Now, what can a parent do? So maybe you are concerned. Maybe you don't know. So it depends on what our problem is. You could support sleep, health. You could be patient and empathic with puberty, if that ultimately is what's going on. You could support safety. And I put here, education when possible, limits when necessary. So sometimes you have to keep kids safe. You have to set limits. But again, by 12, 13, 14, 15, it is not a monarchy like it was when they were 5, 6, 7, 8. It has to become a little bit more of a democracy. So education is a little better tool than control. And when's the best time to educate 12, 13, 14-year-olds? When they bring something up. Okay, when they bring it up. And it might come in the form of, oh, you won't even believe what Susie is doing. She's dating this guy that's 2 years older than her. And what most parents do is they jump in and go, oh, that's so terrible. I hope you would never do that. But you have an opportunity there to say, to put your duct tape on and to say, interesting. Why do you think she's doing that? What would you do if somebody 2 years older than you asked you out? Are you worried about Susie? Right? So you could ask some probing questions. This is the greatest way to probe an adolescent, is to talk about someone else, right? And so if you listen for those opportunities when they say, you won't even believe what so-and-so did or what this teacher did, or I've got this friend at school, that's sometimes a great way to do education. Connections. What can you do to facilitate friendships? I think this is underappreciated. Sometimes some kids are struggling a little bit more, and I think parents have to be more proactive to say, let's figure something out. Can I buy you a couple of movie tickets and drive you somewhere with a friend? Can we pretend that we have this restaurant gift certificate, but I'll go buy it, and you can just call this friend and say we have to use it, and try to get these kids together. Sometimes they need a little more intervention than that, but not control. Oh, and I put connectedness. Learning to talk to your adolescents like you would a friend. It's funny, you're driving in the car, and if you were driving in the car with a friend who kind of did something dumb, you'd be like, oh my gosh, oh, I'm so glad, didn't you see that light up there? You'd be very polite about it. But often you're with a teenager and you go, what were you thinking? You can't drive like that. And if you did that with your friends, you'd lose them. And so sometimes we have this double standard. If you just think about, how can I talk to my kids like I would my best friend? It's amazing, it's reasonable. You don't have to treat them like adults, but you can use that same level of politeness, and you can demand that from them. Let me tell you another word that sometimes feels like nails on the chalkboard: respect. Parents come in and they say, we need this kid to show a little more respect. And that's kind of a complicated word to define, and I think a hard thing to demand. But what you can demand is politeness. You don't have to like somebody to be polite, right? But you can tell your teenagers, I need you to be polite. Competence, and we talked a little bit about that. Express confidence, encourage activities, stand ready to help when needed. Here's one I just want to touch on quickly. Anticipate her need for autonomy and privacy. Research has shown that we do a better job of giving young men privacy than we do young women. And we don't know if that's because we assume that young women want to talk about it, or we just assume, this is where, Dr. Reyes' unconscious bias comes in. We just assume that that's how teenage boys are. They just don't talk. But my girl should talk to me. But all these teenagers, as they practice with independence and autonomy, need a little more privacy. And just because they're closing their door, it doesn't mean they're doing something nefarious. Sometimes they're probably just doing the same thing that they used to do with their door open. But a lot of parents get kind of, you can't close your door when you're in there on your phone. There needs to be some balance here, but I think teenagers need privacy. And in some ways, some have encouraged you to look at your 13 through, particularly a little older, your 15 through 17-year-olds as boarders. They are boarding in your home, and sometimes unpleasant ones. But it's an opportunity that they have for a few years to practice being grown-ups, to come and go, to kind of be on their own, to make a little bit more of their own decisions, to be autonomous. It's practice. But they get to do it under this little sort of protection of your home if they ever need it. And so the more that you can sort of hand over those keys and pretend that you have sort of people just renting a room, but you can still have limits and expectations, and there's still a quid pro quo about when you get these privileges, that you have to do these kinds of things like you would. But if you start to think of them that way, I think it helps, it shifts, and then you start to see some of these things as growth, opportunities for them to grow, and not just to be, annoying, mild but aggravating. Let's do L. I think this is a quiz. Be ready. I don't know. Elle is a second grader who says she hates school. She often refuses to get ready for school in the morning, and when she does make it to school, she complains of stomach aches and tries to call home repeatedly throughout the day. Does anyone have one of these kids by chance? This is a very common story. Someone does? Okay. Now you get a quiz. Okay, so which of these do we like best? What would you do? Have parents drag her to school, even if in her pajamas, drop her off in distress until she learns to manage her anxiety. You laugh, this happens all the time. Arrange to meet with the teacher outside of school to help build that relationship. Together, make a plan to improve daily structure, predictability, and calming breaks. How about teach skills to talk back to the worry and the anxiety? We say things in therapy like, it looks like somebody pushed the yikes button, but is this really an emergency? Or, part of you is scared, but what does the other part think? Or what is worry telling you to do? It's this cognitive thing that therapists do. You got to talk back to that worry. Work with the school to assess academic skills, decrease academic demands, make changes as needed to Elle's schedule, or homeschool. You could do that. So what do you think? Does anyone like one in particular? Really happy with any? It could be. It could be. The clue is this, right? You don't know. If you choose one of these right now, it's because you've already predetermined what you think her problem is. Okay, so you got to think about this. Is there a safety issue? Does she not feel safe? If it's a safety issue, maybe we need to kind of make some accommodations, do something else. Is it related to relationship issue where arranging to meet the teacher could be a really good idea? And we could kind of develop that relationship outside of school. Is it a competency issue where, we need to work with the school to assess her academic skills? Maybe she's just not doing well in school. It makes her feel bad or makes her feel anxious because she's not very smart or she's not keeping up, right? So I don't think home or online school is a very good solution for an anxious kid because then you're colluding. We call that, you're sort of enabling the avoidance. And dragging her there is a really sort of problematic exposure therapy gone wrong, which will just sort of increasingly traumatize them by that experience. But I think any of the others, it really, again, it depends on what's going on with the kid. You've got to work to understand it. Jewel. It's her first year at morning kindergarten, although she seems to do fine academically and socially at school. Her mom complains that she is a terror at home. She seems happy as long as she's not asked to do anything, Parents also express concern about her surprising lack of empathy. I get that a lot. Now, let's just get this out of the way. Should a kindergarten know what empathy is? Some do. I love those kids. But it's a developmental skill to kind of reflect and see what's going on with other people and kind of know how you're affecting them and what their needs are. Like, that's pretty complicated. And so if your kindergartner doesn't have empathy, just wait. But here's a quiz. Let's say you feel confident that this is not a safety problem. What might you recommend next? Okay, so you could make a store with a token contingency system for her to earn rewards by completing desired tasks. We've done those kinds of things. You could coach mom in skills like noticing, I see you're working on something, and praising, you did that, and work on a plan to assist her in making transition time smoother. You could stop asking her to do anything. Or you could diagnose ODD and put her on a medicine. She's oppositional. So again, you can kind of see where I'm going here. It depends. So for a girl who's this age, and there's primarily problems at home and not at school, she's probably anxious, or there's something going on in the dynamic with the relationship at home. And so you would talk, this is what I call working on a relationship with an adolescent. Remember what I said earlier about with a kid. Do you remember what I said about them needing to be seen? Sometimes we interrogate our kids. Hey, what's that? Hey, what are you playing with? Hey, how was your day today? That looks cool. What are you going to do next? What do you want to eat? And that can be a little destabilizing, and it sounds counterintuitive, but for young kids, the best way to build a relationship is just by seeing them and noticing. Look what you did. You looks like you're building a car. Now you're playing Legos. You sound kind of like a football commentator or something, but you're just kind of noticing, and it's harder to do than you think, but kids feel this sense of being seen and reinforced and validated without having to answer questions. So in this case, we might work on the relationship. Now, there might be an issue with sort of the contingency system. If you think that there is a skill that needs to be learned, like we have all these things, we have a good relationship, you just don't know how to transition. You get stuck on one activity and you can't transition to another. So I think this is a skill-based problem. So what are we going to do? We're going to practice and we're going to motivate through practice. That's when it's okay to motivate. You have a very specific goal and you've got maybe some prizes or privileges that kids can earn for working on that thing. But what do we usually do with motivation? We assume that that's the end-all, be-all, that these kids are just not motivated. If they would just try, if they would just put their heart into it, if they would just do a little bit more, if I could just motivate them, then that would be great. But where does that break down? When kids can't. And you never know really when it's a can't, won't situation, and I would just encourage you to go with can't. Go to these needs and say, where can we reinforce one of these needs and not just assume this is a motivation problem? Because what happens with motivation issues? Imagine that you are I think I'm probably going to run out of time. Imagine that you are learning to, hit a baseball, and you just aren't very good at it. But you swing, and your parents start cheering and say, you can do it. And then you swing and miss again. And they say, you need more motivation. Let's bring more people. So they bring all of your friends and your family and all of your neighbors, and everybody's cheering this time, you can do it. And you're like, oh, I'm really motivated now. And you swing and you miss again. And then just to up the ante, maybe dad stands out in the outfield with a $100 bill and says, if you will hit it this time, you can get this $100 bill. Well, you might still swing and miss because you just can't hit a ball. And then what have all of those efforts to motivate done? They've backfired because the kid feels worse because everybody was watching him miss and he didn't get the $100. And so you have to be really careful about assuming that we just need to motivate people. Okay, Julie, we have a couple of teenagers I want to get through in the time that we have. So Julia is 17. Her behavior is increasingly difficult for her parents to manage. She refuses to follow rules, is falling behind in classes, isn't attending church with the family. Her dress seems increasingly inappropriate. Family relationships are tense. Again, before you came in, how do you think about Julia? A friend comes to you and says, I got this teenager, oh my gosh. What can you say? Usually we jump in with, let me tell you what I did. Or let me tell you about something else. Or here's what I think you need to do. So let's think about Julia. Do you take away her phone? Very common strategy. Restrict access to her friends. She's grounded. Work on a communication style that feels safe for Julia to criticize family rules or religious expectations. Offer bigger or better rewards to motivate her to get better grades or to go to church. I hope you won't choose that after that rant that I just had. So it's probably not a motivation problem. And remember, for teenagers, autonomy will take the day. Autonomy will trump everything. Their need for that developmental autonomy, they will tank their own GPA just to save their autonomy if they feel like their parents are controlling them. Okay? Autonomy is going to win. Don't ever get into sort of don't ever get, I was going to say that line from The Princess Bride, never get into a land war with Asia. It's like saying that, getting into a power struggle with a kid who's a teenager who has total control over their grades and you have no control over their grades is not a very good idea. So in this particular case, because things are tense at home, I'm going to say that there's probably a safety issue. And even though parents will say, well, my kid is safe, if a teenager can't come to their parents and have a conversation without somebody being angry, misunderstood, or, and here's the saddest one in my office, wounded. I have these wonderful parents, these beautiful families, but kids come in and say, I could never tell my mom that I'm struggling with this because it would hurt her too much. I don't think she could tolerate it. I don't think she knows. She has such high expectations of me. And so if your kids don't feel like they can talk to you without someone being misunderstood, wounded, or angry, then you have a safety issue. It's not about relationships or competence. You need to work on safety. I just want to say a little bit about these two issues that come up a lot, and I debated whether to do this because I don't want this to be about rules. I want it to be about principles and this triangle. I keep doing this, Maslow's triangle. But people ask me a lot about this, and I think it's important to know that adolescents are pretending to be adults. And I don't mean for that to sound patronizing for teenagers that are here, but they are. They're practicing this. And so even when it gets into dressing a certain way, oh, actually, it looks like I'm talking about phones first because my clicker did that. So the phones. Remember that teenagers are not addicted to their phones. They're addicted to one another. And if you really think about it, even when I was a kid, we had those landline phones, with the cord, and you'd see people, you walk around the house with that, and you'd trip people with the cord, and you'd stay on for hours and hours. We don't have the same kind of technology, but teenagers haven't changed significantly, but their technology has. So try to be empathic in that regard. I do think it's okay to monitor phone use, but you're not doing it to bust them. You're just doing it to observe and to teach, and you should probably let them know that you're doing it. Parents get in a little bit of a bind if they're secretly monitoring their teenager's phone, because if you discover something, you have no way of telling them how you discovered it without it being a total blow-up. Consider setting limits during meal times, car time, and curfew. Why do I say that? Because a lot of research says that this is where family bonding can still occur, and it seems to be important for families to have meal times, to drive in the car. You're trapped there, and usually you can talk, or there can be kind of a curfew at a certain time. The best predictor of future behavior is past behavior. There's very few psychological principles that stand true through all eternity, it seems, and this is one that comes up a lot. So if she's never given you a reason to cause concern, don't assume that she's doing something wrong. But if you have had kids that have struggled with their phone use and their boundaries, then it probably is okay to explain to them that that's why they may need a little more monitoring. And then this I already said, stir up empathy. All right, playing adult is not the same as acting like an adult. Just because kids, we were talking about this earlier, just because kids are shooting guns, it doesn't mean they're planning on being killers. And just because kids are dressing in certain ways, it doesn't mean that they're going to have sex. Sometimes it just means that they're playing to look like grown-ups. And so be careful in how you communicate your need for discretion. I have some examples here. When you say you aren't going to wear that, are you? Your daughter might hear, your carefully crafted attempt to look more mature has failed miserably. You have to be careful. When you say you look like a tramp, she will not hear, you are presenting yourself in a way that our culture often associates with promiscuity. That's what you mean. She won't hear that. You could try things like, honey, you have captured a look meant for adults, but it isn't appropriate for 14. Or are you wearing that for you or for someone else? This is a really valuable question. And you could ask it with their peers when they're getting into different complicated situations. Do you think she's doing that for her? Is that what she wants to wear or what she wants to do? Or do you think she's doing that for other people? And this is a great way to empower our young women, to let them know that they can make choices that are for them. And you can reinforce that over and over again. Or you could try something kind of humorous and say, that outfit is likely to draw sexual attention, and no one in this house is ready for that yet. And try to make a little bit of a joke about it. Okay. So back to Julia. Again, I don't mean for this to get boring, but I want it to be hammered into your brain. Physiologic, is she sleeping and eating well? Teenagers often are not. Safety, am I a safe person to talk to? Are they overly worried about adult expectations or plans for the future? Am I burdening these kids by making it sound like, this one more thing that I hear a lot, parents say, the reason I push them is because I know they're capable of so much. And that sounds like it comes from your heart, but do you know what teenagers hear? Now if I don't meet so much, this expectation that parents know that I'm capable of, I'm a failure. I don't even know who I am yet or what I'm capable of. I'm still figuring that out, but here's the expectation. And so it doesn't always come across as encouraging. You have to be so careful. Do I want to say anything more on that? I think sometimes one of the best gifts that you can give kids is an ability to surpass their parents' expectations. If you tell your child that you expect them to get straight A's because you know they can, guess what? You've put them in a position to either meet your expectation or not, to fail. If you say, I know that you can get B's, you might give your kid an opportunity to come home with a big grin on their face and say, you thought I could get a B, but guess what I did? I got an A. And that might be the biggest gift you can give them. So be careful with your expectations and make sure there's room for these kids with their own initiative to surprise you. And allow yourself to be sort of delighted when your kids show up and do amazing things. Your expectations can spoil that for you and them. Connections, are they isolating from others? How do they feel about relationships? Do they feel unloved? Do they feel like they're a burden? How can I better connect this person or facilitate other meaningful connections? And we've talked, I think, a lot about that. And competence, do they feel broken or inadequate? How can I remind them of their strengths and convey confidence, trust? This could be a 17-year-old confidence issue. Boy, I see a lot of 17 and 18-year-olds, and they feel this burden of life sneaking up on them and are not quite sure what to do with it. Okay, this is, I think, my last example. I think we're doing okay. Kim is a 15-year-old who came to the attention of a school counselor when a peer reported that Kim had drug paraphernalia in her locker. She also has attendance issues, and during a meeting with the counselor, Kim reported depression with suicidal thoughts. Okay, now it's getting real. Has anyone ever reported suicidal thoughts to you? If you've ever had a reflex to fix something and fix it fast, it comes then. Oh, we got to fix this. We sort of panic a little bit. Here's a quiz. What do you do next? Ensure safety by asking about access to weapons, a specific plan to kill herself, alert parents or crisis services. Do you counsel her about how the choices she's been making about peers, drug use, school attendance are likely related to her depression and suggest strategies for making changes? Do you offer empathy for her situation and listen carefully without giving any specific recommendations or advice? Or do you praise her honesty and express confidence that she will figure out a way to get through this? What do you think? Pay attention to what your reflex is and what you think you really ought to do. A lot of people here say safety. We got to make sure she's safe, right? You start at the bottom of the paragraph or the pyramid and you start working up. You don't know yet that she's not. You don't know. Somebody that's thinking about suicide isn't planning it necessarily. There's suicidal thoughts or a symptom of depression. I would encourage you not to panic, but to stay there and say, okay, I want to sit in your shoes for a minute. I want to feel this. I really want to understand this. And so I would encourage you to be empathic and to just listen. Tell me more about that. How long has this been going on? You need to find out more before you know what to do. Okay, so after you've given impactful empathy and an effort to ensure her safety, which would come next, right? You just got to make sure the safety thing's in place. Kim's no longer suicidal, but still struggling with staying on top of her schoolwork and is no longer participating on the cross-country team. She continues to complain about depressive symptoms. Now what? Tutoring for academic problems, consider ways to improve her social relationships, refer her to individual psychotherapy, closely monitor her for continued drug use, possibly regular drug screens or a referral to substance use program. What are teenagers? Remember that Maslow and Erickson? What are teenagers' most important competencies and relationships? Friends and identity. Okay, so sometimes we jump in and we want to control the situation. We focus on the drugs, we focus on the school, we focus on competencies. Okay, it's at the top of the pyramid. If you take away a person's access to friends by taking their phone away or by grounding them in order to do better in school, how often is that going to work? Maybe short term. Long term? No. It's like a house of cards that falls down. If a kid is feeling isolated and disconnected, they will never perform as well as we need them to. So fall back on those relationships. Shore those up. What can we do to encourage better social connections for you because you're feeling isolated right now and struggling in school? If you jump right into the school thing, you're going to miss the boat. Okay, so I just want to summarize here with this slide. I think this is important. What a person needs is the same as what they need to be resilient. It equals wellness. It equals motivation. It's as simple as a little pyramid. I hope you will go home thinking about that little pyramid. If you have people that are struggling in their lives, you have a way to assess the situation, not make assumptions about what caused it, but understand what the person needs. And you just start at the bottom. Somebody with depression, you might jump in and say, oh, what you need to do is learn these other strategies. That's competency. That's at the top. Some people with depression need a meal or a nap, right? Physiological needs. Please start there. If your kids are doing well already, if our young people are doing well, how do we continue to use these principles to help them? I would love it if I could magically wish something. I would wish for parents on a daily or weekly basis to look at their kids and ask themselves, how are my kids doing with safety, connection, competence? What can I do this week to help improve and facilitate their sense of safety, their connections, and their competence? That is how you build resilience in kids. Now, the principles in the framework are simple, but application is kind of interesting. It's hard to say, okay, I think my kid is struggling with relationships, but I'm a little stuck knowing how to help that. It's fine to notice that they have a problem, but sometimes families get stuck. So the other question I often get, when do I need to go see a professional? Too many people think they need to see a professional, I'll tell you that. I think always you ought to be able to start as a caregiver or as an influencer and say, okay, I'm going to do my assessment. I can see that we need to work on safety. So we're going to use our greatest asset, which is our creativity. We're going to use our own creativity to try to work on this. Don't be afraid to try on your own. And then when you need a therapist, you know you need one. You can go to a therapist and say, look, this is where I think the problem is. This is where we've been trying, and this is where I'm getting stuck, and now I just need a little more help. That helps frame what your therapy is for, so you don't get in the weeds and end up doing this eternal therapy week after week after week. You've already got a frame for what it is that you need, and you feel more empowered as a parent to assess the efficacy of that therapy over time. Are we improving? Are they feeling more safe? Okay, so this is a framework. I should have added another equal sign and said for knowing when you really need help or when to find a therapist. But I hope you'll go home thinking about this pyramid, and you'll think about the people that you love and think about what they need and what they can become and not what caused them to end up where they are. Thank you.